To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Today we're going to talk about knee replacement surgery because I am joined by Dr. Campbell from OSI down in the Fox Valley. Hi, doctor.
Hi, Brian. How are you doing?
I'm doing good. I'm glad you're here because we were talking a little bit about knee replacement surgery and all that entails. Maybe you could start off telling our viewers when you might think you need one.
Yeah, so knee replacement surgery is something that patients will consider when non-surgical treatment has not worked for their knee pain and stiffness. So it's something that patients consider when they want to live more pain-free and get back to their regular activities.
Yeah, you don't want to be so limited that you're limping around and all that. One big thing we talked about is some people have maybe a little trepidation about recovery. What should we expect from recovery?
Yeah, so recovery after knee replacement typically is a 5 to 6 week process. Most patients hear about their neighbor or friend going through it and are intimidated by the thought that it's going to be a very painful recovery. So with my patients in our practice, we really try to address those concerns, let them know what the plan is, and ensure that they're going to be in the safest possible place to recover safely and with less pain.
Yeah, and the recovery in while you're there is beautiful. We've taken a tour. But the other thing, you've developed a home-based recovery model, and I think people would be interested in that.
Yeah, so what we've learned is that patients like to recover at home. It's a familiar environment to them, and what we've seen is that it's a safe place for patients to recover. So after surgery, patients go home on the same day. They're sleeping in their bed at home, and we prescribe a period of rest, ice, and elevation to help mitigate the traditional symptoms of pain and swelling after surgery, and it's worked quite well.
Yeah, I think a lot of us think the minute you're out of surgery, you got to start working that sucker back into shape. That's not the case, is it?
Yeah, in my practice, we've actually found the opposite. So people who are very aggressive with their physical therapy really early on, it tends to actually slow them down, creates more pain, more swelling, and they're having to take more pain medications to combat those symptoms. So we really like patients to focus on elevating, resting, icing, so that initial pain and swelling is very manageable. They take less pain medications and they recover quicker.
Well, I think, and that's the OSI model, right? Which is why you've been voted Best of the Valley 2 years in a row.
Right.
Well, Dr. Campbell, thanks so much for kind of walking us through what the expectation of recovery would look like after that, and the biggest thing, getting back to your life, right?
Right, that's the goal, getting people back to what they want to do.
All right, doctor, thanks so much, and we want to thank you for watching To Your Health.
The preceding was a paid advertisement.